Today we are going to speak on the topic development of occlusion in primary dentition. Occlusion refers to the spatial relationship between maxillary and mandibular teeth when they are in contact with each other. Chronology of primary tooth eruption begins around 6 months of age. There are a total of 20 teeth. In the maxilla, there are 10 teeth, which includes 2 incisors, 1 canine and 2 molars. In the mandible also, there are 2 incisors, 1 canine and 2 molars. Key stages in occlusion development. At around 6 months till 1 year, first teeth erupt, which are the lower central incisors. By around 2.5 to 3 years, all primary teeth are present, occlusion is established and the child starts developing bite relationships. Features of ideal primary dentition occlusion. First is subspecific. Primate spaces. Primate spaces in the maxilla are present between the lateral incisors and canines, whereas in the mandible it is present between the canines and the first molars. Then comes the physiological spacing, which is very vital for accommodating the future larger permanent teeth. Next is the incisor relationship. First is the overbite. 10 to 40% of vertical overlap of maxillary over the mandibular teeth are present. Next is the overjet. 1 to 2 mm projection of the maxillary incisors are present. Canine relationship. Usually in primary dentition, class 1 canine relationship is seen. In class 1 canine relationship, the maxillary canine cusp tip is in line with the distal surface of the mandibular canine. Next is the important feature, which is the terminal plane relationship of the primary second molars. There are mainly 3 terminal planes, which is the flush terminal plane, mesial step and distal step. Flush terminal plane. The distal surface of the upper and lower second molars are in the same vertical plane. It may transition into class 1 or class 2 molar relationship. Mesial step. In mesial step, the mandibular second molars are mesial to the maxillary molars. It favors class 1 relationship. Distal step. In distal step, the mandibular second molars are distal to the maxillary molars. It predisposes to class 2 malocclusion. Importance of the primary occlusion. It guides the permanent teeth eruption, helps in jaw growth, and then prevents the future orthodontic problems. It also affects the masticatory function, speech and craniofacial development. Next we will see about the common malocclusions in primary dentition. The most common malocclusions which are seen in the primary dentition are anterior open bite, posterior cross bite, midline shift or crowding or spacing abnormalities. To summarize, primary occlusion is a critical feature in future dental health. Early detection of abnormal occlusal patterns allows for interceptive orthodontics. Emphasis of periodic dental evaluation during early childhood is essential. Thank you.